Hello everyone. Today I will be discussing about the clinical features of endometrial cancer. Endometrial carcinoma, commonly known as endometrial cancer, predominantly presents with abnormal uterine bleeding, observed in 75 to 90% of the cases. The volume of abnormal uterine bleeding does not directly correlate with the risk of endometrial cancer. However, factors such as age and underlying risk factors significantly influence the likelihood of the disease. In postmenopausal women, any vaginal bleeding is considered abnormal and warrants evaluation. A meta-analysis revealed that the pooled prevalence of postmenopausal bleeding among patients with endometrial cancer was 91% irrespective of tumor stage. The pooled risk of endometrial cancer among patients with postmenopausal bleeding was 9%, with estimates varying based on hormone therapy use and geographical region. In premenopausal women, the risk of endometrial cancer is lower. However, patients aged 45 to 54 account for 17% of the endometrial cancer cases, and those aged 35 to 44 account for 5%. Bleeding patterns in this group may include intermenstrual bleeding, frequent episodes, less than 21 days between episodes, heavy bleeding, that is total volume exceeding 80 ml, or prolonged bleeding lasting longer than 7 days. Additionally, prolonged periods of amenorrhea, 6 or more months due to anovulation, may occur. In younger women, less than 45, abnormal uterine bleeding tends to be persistent and often occurs in the context of unopposed estrogen exposure. That is, example, obesity, chronic anovulation, failed medical management of the bleeding, or in patients at high risk of endometrial cancer, example, Lynch syndrome. Abnormal cervical cytology. Patients with endometrial cancer may present with abnormal cytology findings on cervical cancer screening. These findings may include endometrial cells reported in patients aged 40 and above, atypical glandular cells, or adenocarcinoma cells, which may be endocervical or endometrial. The sensitivity of conventional pap smears for endometrial carcinoma is 40 to 55%, while liquid-based preparations have a higher sensitivity of 60 to 65%. Incidental findings on imaging. A thickened endometrial lining may be discovered during imaging studies such as ultrasound, CT scan, or MRI performed for other indications. Incidental findings after hysterectomy or during abdominopelvic surgery. Endometrial carcinoma can sometimes be identified incidentally when a hysterectomy is performed for benign conditions. To minimize this occurrence and optimize the surgical procedure, all patients with abnormal uterine bleeding undergoing hysterectomy should have endometrial sampling with results available before surgery. A database study including nearly 230,000 patients who underwent a hysterectomy for benign conditions found that 0.96% had occurred uterine cancer, with 75% being endometrial carcinoma and 22% sarcoma. The risk for occult uterine cancer was low, 0.10% in patients aged 18 to 29 years, and much higher, 4.4% in patients aged 75 years and above. The risk was significantly associated with race, ethnicity, obesity, comorbidity, personal history of malignancy, and reason for hysterectomy. Thank you.